John, State Health Commissioner Valerie Davidson says Medicaid expansion is very much moving forward and that the department would have loved to roll it out last January or even in the next couple of months. But to make sure all the issues are addressed properly, Medicaid expansion is set for this summer.
On behalf of everybody in the state, I just want to say to you, Governor Walker, thank you very much.
Friday, Governor Bill Walker and State Health Commissioner Valerie Davidson announced the state will be rolling out Medicaid expansion this July.
41,000 Alaskans will benefit from expanded Medicaid. That's a big deal. That's a really big deal.
Davidson released 2 reports today, one of which that has analyzed Medicaid in Alaska for a decade. In the first year of Medicaid expansion, 20,000 Alaskans are expected to enroll, and federal share is $145 million in match.
One of the things that has been hard in just looking at our past and where we are is that expansion has been available to Alaskans with the 100% federal contribution since January 1st. If only we as a state had been ready to move forward.
Davidson says there are also significant savings from expanding this federally covered program.
The initial savings in the first year are about $6.1 million during the first year of expansion alone, including $4 million in savings in the corrections budget, $1 million in catastrophic and chronic medical assistance program, and $1 million in behavioral health grants.
It's not about just bringing revenue and jobs. It's about doing what's the right thing to do.
One of the things that I really appreciate about Governor Walker is that at a time when we are facing a budget challenge, I think it would be really easy for people to walk away, but real leaders step forward, and that's what Governor Walker has done.
The more than 40,000 Alaskans that Medicaid will be extended to are people who are employed, recently employed, or actively looking for work.
These are individuals who are typically working Alaskans. Nearly 44% of the newly eligible population are actually working Alaskans. They are people who work but don't have incomes that are of a sufficient level for them to be able to afford health coverage.
Despite all the challenges the newly elected governor is facing, such as dropping oil prices and still maintaining progress on the state's gas line, ensuring Alaskans have health care is a promise Governor Walker has kept since the beginning.
One of the campaign commitments that Byron Malott and I made is that on day one we would begin the process on implementation of expanded Medicaid, and we were happy to do that.
Now, Commissioner Davidson says the department does not have all the answers for Medicaid reform yet, but Alaskans can expect the same amount of transparency they saw with the transition process as they can with Medicaid expansion.